Welcome to the Medical Marijuana and Wellness webinar series. Tonight's topic is ketamine for pain and mental health. Important topic and an important product that's been helping many people. Tonight's co-host is Turner Davis, and Turner has a broad background in this particular subject, and I'll let him tell you about himself and also a little bit about his clinic.
Yeah, thanks, Mark. I appreciate you having me on tonight. So my name's Turner Davis. I'm a pharmacist, been a pharmacist for almost 20 years. Done a whole, different line of services in the pharmacy world, from working behind the counter to compounding to home infusion, those sorts of things. And been working in the medical marijuana space now for about 5 or 6 years. And really that's kind of gotten, sort of piqued my interest in the alternative therapy sort of pathway that's really, getting more and more attention now as we go forward, between especially with mental health becoming such an issue and there's more and more awareness every day of the underserved population that mental health sufferers really have to deal with. Having these alternative therapies like ketamine, like medical cannabis, like for example, there's psychedelics that are coming down the pathway approvals for those in the next few years. I think we'll have a very wide range very soon for some very difficult to treat conditions. Ketamine, as we'll discuss tonight, has really been found to help treatment-resistant depression, which is something that's very challenging to treat and for practitioners and obviously patients who suffer from it, as well as PTSD and those other sorts of really can be intractable mental health conditions if not treated in the correct manner. Tonight's webinar, I really wanted to kind of go over, there's been a lot of talk in the news in the last year or two. A lot of ketamine clinics have opened. A lot of discussion about ketamine as a mental health drug has really come to the forefront. So just wanted to kind of touch on some of the facts and really kind of talk about what it looks like and who may be appropriate for it. So
great. Well, listen, Turner, why don't you just we have a presentation. Why don't we go right there and tell us about ketamine? I know it's very important for a lot of people with pain and also mental health.
Well, it sounds like a plan. Well, I'm going to go ahead and share my screen here. Right. So like mentioned, we're just ketamine infusions for mental health and chronic pain tonight. A couple of types of conditions that really respond better to ketamine therapy than others in these two categories. For mental health, anxiety, like we mentioned, treatment-resistant depression, post-traumatic stress, those are really the primary categories that we see the most benefit in. And for chronic pain, it's really more neurological-based pain conditions like chronic pain, fibromyalgia, migraine headaches can respond well to ketamine infusions, very chronic migraine headaches. So those are the kind of things we'll talk about and discuss tonight. But let's talk about what ketamine actually is as a medication, as a therapy. It is, it has been approved for a very long time as a surgical anesthetic. The FDA approved the drug for use in 1976. It was originally used in the military as a battlefield anesthetic. And, it was found to have some very unique characteristics that lend itself well to surgery analgesia, but it also has hypnotic amnesic as well as analgesic effects, which is something that's unique to ketamine. The fact that there's really no other medication that has that particular therapy profile all in one drug. So we kind of use a little bit of that, all of those effects when we're using ketamine infusions for mental health and for chronic pain conditions. After, like I mentioned, it has been approved for over 50 years for surgical anesthesia, but really it was in the early 2000s, late 1990s, early 2000s that more and more researchers started to look at ketamine. What would happen is someone would go in for surgery who may also have been suffering from depression or PTSD or those sorts of things. And when they came out of surgery, they reported that, hey, my mental health symptoms feel better. I'm performing better. I feel better. I'm less depressed. And so the doctors really started to look at that and say, well, what's happening here? And, they did more and more work on it. And in 2006, the Journal of the American Medical Association, which is sort of the gold standard journal of medicine in the United States, it really identified quantified benefit in treatment-resistant depression with ketamine infusion therapy. So that's really kind of where the obviously when a treatment or a therapy gets published in an important journal like that, a lot of doctors nationally really picked up on that. And since then, a lot of work has been done on PTSD, anxiety, chronic pain, and migraine headaches. So how's it used? Currently, ketamine therapy is available through several different routes of administration. It can be injected just with a syringe and needle intramuscularly. It can be used as a sublingual troche, which is something that it's like a lozenge that you put in your mouth and let it dissolve. There is an FDA-approved nasal spray on the market now that was approved in 2021 called Spravato that is also approved for treatment-resistant depression, as well as the intravenous therapy, which is the original route that was studied and still the route that is considered to be most effective, intravenous. And that's with most therapies. If intravenous does typically work, is the most effective of the different routes of administration because it bypasses a lot of the metabolism that goes through when you take something orally or even injected intramuscularly. There's metabolism that takes place prior to the effect taking place. But with intravenous, it's a direct effect and goes straight to the source that you're trying to treat there. So effectiveness around intravenous injection would be next, the nasal spray, and then finally the sublingual. Anytime you're using something orally, it is typically considered to be the least bioavailable or efficacious. You usually have to take it more frequently or take a higher dose or those sorts of things, and that's the case with the sublingual route as well. So when we talk about ketamine infusion therapy, studies have shown that low doses of ketamine infused over anywhere from 1 to 4 hours can improve many symptoms non-responsive to standard therapies. The thing with, as opposed to using ketamine as an anesthetic, surgical anesthetic, as opposed to what we do in the ketamine infusion clinic for mental health is a much lower dose with the longer infusions. We only use about 25% of the dose that we would use for anesthesia. We don't want to put someone all the way under. We want to create a mild disassociation, sort of a waking dream state is really the goal. Relaxation, letting your mind basically free itself from some of these, hardwired connections that have developed over time with the chronic depression, with PTSD, with the intractable anxiety, and it allows your brain to sort of create new pathways and really you're training your mind to look, and deal with the mental health in a different way, and that's really what can improve the symptoms over time. I'm going to play a quick video here. It's only about 2 minutes, but I like this video because it's a good description of what the experience of ketamine infusion typically is. This is a very typical response we hear from patients a lot of times, and I think they do a good job here explaining both what the experience is like and sort of the benefits.
It looks like a spa.
Alexa, play meditation music.
A place Rachel Bush has gone to unwind.
Is the music loud enough?
It's loud enough.
But this is a medical procedure where Rachel is being treated for PTSD, depression, and anxiety with an injection of ketamine.
The past few months were rough.
After an assault that nearly killed her, she was prescribed antidepressants that just didn't work.
I was contemplating suicide, wishing that I had been finished off.
Then someone told her about Dr. Quan Henderson, owner of Mindscape Ketamine and Infusion Therapy.
It kind of helps kind of remodel the brain, the way it feels about certain things.
Ketamine affects your brain's neurotransmitter called glutamate. You can liken it to how Zoloft affects the neurotransmitter serotonin. Ketamine often gets a bad rap because of its history with people abusing it. Its street name is Special K, but it's been used in medicine for decades.
Ketamine is an anesthetic that's been around for 50 years, but in the last 15 years it's actually been used for treatment of mood disorders that are resistant to certain medications.
Dr. Henderson opened this practice after ketamine helped his wife, Stacy, who'd battled depression for years.
I couldn't believe it. It was just such a wonderful, life-changing experience for me.
KHOU's mental health and wellness expert Bill Prasad warns ketamine has addictive properties, although it's on the lower end of the spectrum. He says ketamine should be used sparingly and hand in hand with therapy. The FDA has not approved injecting ketamine for mood disorders, but the VA hospital does use it to treat PTSD and reports positive and immediate outcomes.
This is a miracle medicine.
Rachel says it worked on day one for her and describes the experience like this.
It's almost like I'm slipping away into a good dream. And things just start to make sense. Something changes. You see that you're not in crisis mode. You see the light.
Dr. Henderson says the effects can last months to years, depending on the person.
In my opinion, it's a cure for depression and PTSD.
So obviously, everyone's experience is a little different with ketamine infusion therapy, but again, that is a very typical response. And studies do show upwards of an 80% response rate for PTSD, 70% for treatment-resistant depression, and it really works quickly. So I mean, it is, like they mentioned, the pathway is unique in the way that ketamine affects the brain and affects the neurotransmitters more. We don't have a oral drug that will affect the glutamate pathways like they mentioned, like ketamine will. So, this is a slide here if anyone's interested in really digging into the neurochemistry of how ketamine is theorized to work. Again, everything's sort of theoretical on how it actually does work so well in certain patients here. But one of the big things research has shown that ketamine can do very uniquely is that because of the glutamate surge, it blocks the uptake of glutamate, which makes glutamate more available in the brain. This leads to a cascade which can result in synaptogenesis, which means new neural pathways forming, and the reversal of negative effects of chronic stress, depression, especially within the prefrontal cortex, which of course is the reasoning center of the brain and where we deal with a lot of trauma and stress and those sorts of things. So really, again, just by remapping or remodeling some of the pathways that the brain has become really incalcitrant and really locked in over years, we're training the brain with the help of ketamine to approach things in a different manner and give your pathways, your neural pathways, another outlook essentially on how to treat or how to deal with depression or PTSD. The biggest benefit of ketamine is the speed in which it works. It can work in as little as 2 hours. Typically, patients will report an improvement in symptoms within 3 infusions. The typical for mental health therapy, the typical therapeutic procedure is a total of 6 1-hour infusions, typically over 3 weeks. So we'll do 2 1 week, 2 1 week, 2 each week basically, or sometimes it's spread out a little further. We'll do 2 2 1, skip a week, and then do another one. So six infusions total as an induction series, though, is what we call that. And then you move to a maintenance schedule of 1 infusion per month or as needed. So basically it's just based on how you feel. If you feel like you're needing a booster, you'll come in, once a month or once every other month after the initial induction series. Typically the doctors will reassess a patient after the first 4 infusions. If there's no improvement at all, sometimes they'll recommend, stopping the infusions because, it doesn't work. 70 to 80% is not 100%. Doesn't work for everybody. So we don't want to be treating a patient if they're not responding well either. But again, there are very few medications out there that have that high of a response rate. So we do see a lot of success with particularly with the mental health conditions and ketamine infusion therapy. That 6-dose induction series is supported by evidence reported in the literature. When we look at the number of infusions, every data point here is a different study, and they all use different numbers of infusions, but we see the highest response rate in those studies that used 6 as the number of infusions for the induction series. Again, some patients, feel better after 4 or 5 and don't want to continue to the 6, but, we do recommend that patients typically we'll use that 6 infusion as sort of a benchmark, since it is supported by most of the evidence out there. And the ketamine, again, you see the dose, 0.5 milligram per kilogram. That's pretty typical of where we start patients, and then increase with each infusion to as much can be tolerated. Usually somewhere around 1 milligram or 1.5 milligrams per kilogram for patients.
Turner, I think it's important to point out that what you're really doing is you're really putting together a personalized program for every patient. I mean, you're paying attention to how ketamine's affecting them in their body and really making sure you're putting together a regime that can help them.
No, that's correct. And every patient's mental health is unique, and as well as everyone's response to treatment. So, we absolutely want to start low, go slow, and make sure patients have a good experience and really, as well as get the most benefit as possible from the therapy. So we do use the evidence-based approaches with our infusion therapy. We're not just winging it out here. Everything we do is based on studies and general consensus. There are guidelines that have been published by the Journal of Psychiatry in the U.S. to sort of guide some of these ketamine infusion therapies too, and that 6-dose infusion is something that is recommended for most patients. So for the chronic pain side, it's a little different than the mental health side. And like I mentioned before, this ketamine therapy for pain is really most effective for neurologic pain, complex regional pain syndrome, fibromyalgia, persistent migraine headaches, neuropathy, things that are difficult to treat, honestly, with the options that we have out there. Ketamine's not all that effective for inflammatory conditions. It can help somewhat if there's a neurologic component to it. Things like back pain and those sorts of things. Some patients will respond, some won't respond as well. But it's typically a short-term relief. So, you'll basically do a 3-dose infusion induction series for chronic neuropathic pain. Usually a longer infusion, 2 hours over 7 to 10 days. If there is a good response, then the patient will move ahead to a maintenance schedule. Again, depending on their symptoms, if their pain comes back, they may need to, more frequently, then they'll need to come back for more booster infusions. But the response rate is typically 50 to 60% of patients with chronic pain, so not as effective as with the mental health side. But for some patients that have tried everything else and honestly seen very little benefit, this can be, we have seen it work very well for certain patients. Fibromyalgia, I think of in general, we have several patients that I can think of off the top of my head that have really life-changing results, with ketamine therapy. So, it's an individual, again, choice on this, based on how well you have responded to other therapies, how chronic is your condition, but it is something that can help in certain cases for sure. So how would you start ketamine infusion therapy? If this sounds like this is a good, something that you're suffering from, you identify with some of the things that we've talked about so far, you're interested in starting ketamine infusion therapy. The first step is going to be to contact a specialty clinic like New Horizons for an initial assessment. That can be an interview. It's typically for our procedure, we interview a patient to see, do we think they would be a good candidate, or do their symptoms sound like something that ketamine can actually improve? At that point, we would obtain your medical records for physician review. Our practitioners will go over your medical records to make sure that there are no health complications that ketamine may exacerbate or conflict with. If approved, after we look at all that, if approved, we'll schedule the appointment. Now, like any procedure, the day of appointment, you do have some certain rules we want to make sure you observe. You want to hold any medications that you're able to hold safely, so they won't interfere with the ketamine. And then no food for 4 hours prior, no drink for 6 hours prior. Nausea and increased urination or side effects of ketamine infusion therapy. So we do, want to avoid any of those issues as we go forward with the infusions. You want to bring some of your, we encourage people to bring some of their favorite music or anything they like to use to relax. After the infusion, whether it's 1 hour or 2 hours, the physician will typically observe the patient for 20 to 30 minutes to make sure there are no lingering effects. And having a ride home after the infusion is one of the most important things. Really, you should not drive for up to 24 hours after a ketamine infusion. Obviously the ketamine infusions stop very quickly, or the effects will last. It only has a half-life of 5 minutes. So when we turn off the infusion, side effects typically resolve very quickly. But as a matter of safety, we do want to make sure that that you do have a ride home, and that there's no lingering after effects that that may hamper your ability to operate a vehicle.
And I think it's important to point out, Turner, that ketamine is safe to use.
Absolutely, ketamine has been, again, approved for 50 years. Used in, it's one of the big surgical anesthetics for children because of its safety profile. It is safe to use in kids because it does have a very low, very good side effect profile. And again, side effects resolve quickly after the infusion stops. So, we see very little. We've done several hundred infusions in our clinics, and really have seen no problems with patients. You really during the infusions or after that can't be managed, per protocol, and are very simple to manage in the clinic. So as far as side effects, typically nausea is number one. We do provide medication in the infusion to prevent nausea, and we'll send you home with some nausea medication just in case there's any lingering effect there. It can cause elevated blood pressure during treatment. So when I mentioned we look at medical records, if you have uncontrolled high blood pressure or not taking medication, that would be something that we would be concerned with. Obviously excessive sedation is what we try to avoid, but it can occur. But, there are medications that can rapidly, if you get too sedated, we provide, medications that can rapidly reduce the effect of the ketamine. Certain medications that would reduce the effect of ketamine, Lamictal, benzodiazepines like Xanax or Ativan, naloxone. So those types of medications are things that we would try to hold the day of infusion to prevent the effect of the ketamine from being blocked by some of the other medications out there. So, just some considerations there when providing ketamine infusion therapy. So, cost is unfortunately a barrier for a lot of patients for ketamine infusion. Unfortunately, a lot of the patients that would really respond or benefit most from the therapy, the cost can be a barrier. We do try to work with patients as much as possible, but unfortunately, there is a real cost factor as far as provider time and those sorts of things that occur when you're doing 1 and 2 hour infusions that have to be covered. But typically, you'll see prices range in a clinic for a 1 to 2 hour treatment from $350 to $600, or chronic pain $500 to $800. At New Horizons, our 1 hour infusions are $300. Our 2 hour infusions are $450. So we do try to be a little more as cost efficient as possible as opposed to the competition. So, if that is something that oftentimes you will have to shop around a little bit for to find the best price. We can provide.
I think that's important to point out, Turner. You've put a good price on it, mainly to be able to help people, not because it's less quality.
No, exactly. No, the quality of the medication is the same. The quality of the practitioner care is the same. We're just able to provide it a little bit cheaper than some of the other clinics out there because we can share cost a little bit with some other things. So, that's the only reason we're really doing that. We do provide a bill or an invoice for submission to your insurance company after the infusions. Some insurance companies will reimburse for it. We will help patients with that. We do have a program to help patients obtain that reimbursement if it is something the insurance will consider. So that is something to consider as well. So when we talk about New Horizons specifically, the clinics that I have help and work with, we're physician supervised. In most of our locations, we do use some nurse practitioners in certain locations that are more rural. It's hard to get doctors, to places like Winter Haven and those sorts of things. But yeah, we do, everything that we do, even with the nurse practitioners, is overseen by a physician. So we do have experienced professionals on site during these infusions that have a lot of infusion experience. That was very important. The nurse practitioners that we do use are very experienced in with infusions, so that's not no concern there. We do have a therapist on staff that can reach out and set you up potentially as for follow-ups. I think therapy is important. Talk therapy is important to accompany with the ketamine therapy. Much better outcome long-term when we use therapy in conjunction with ketamine infusions for treatment-resistant depression, PTSD, those sorts of things. Follow up with our special patient care software. We use a system called Osmind that has tools that you can communicate with providers as far as scales, progress scales to see how you're doing over time. And it allows the doctors and the practitioners to monitor your progress and reach out if they see any issue that that you may be having. So with that, I'll wrap it up. We are operating in 3 locations now. And if you have any questions, reach out to us. Thank you, Mark.
Thank you.